What's up, besties? Welcome back to Talkin Schmitt. I am so excited to see you. You guys, we have a great episode today, but before we get into that, I want to talk to you because the Artist Way is starting next week. So if you didn't get your book, I need you to go get your book. And if you're not going to do it, that's fine. Just know that everything we do for the Artist Way will be at the end of the podcast. So it's just going to be like an additional thing that we're doing for fun together. If you don't want to do it with me, I totally understand. It's honestly a lot. It's like a commitment to yourself that like I'm scared to make. I'm scared to do it because I haven't done it in so long and I know how much time it takes to do. So it is a commitment, but it is a beautiful commitment to yourself, to your inner artist, to your inner child. So if you want to be a part of that journey with me, I would love for you guys to come on that. I am in Chicago today. And I am with one of my oldest, dearest friends, Dr. Eric Anderson. We went to Marquette University together. And quite honestly, we were just like partying and fucking drinking. And I won't say anymore because I don't want to say anything about him that he doesn't want said. But he is wonderful. He is so smart. He is one of my most accomplished friends. Like, I can't believe we went to college together. And then he went to med school and I went to jail and I became a comedian. So I am so excited to have him. You guys sent in a ton of questions. We get to most of them. There's a few we leave out because we just didn't have the time, but we were really having the time of our life talking. So I hope you guys enjoyed this episode as much as I enjoyed having this conversation. See you later, besties. What'd you say? I said, don't make it weird, Eric.
I made it
and
weird.
You immediately
made it weird right away. Okay, sorry.
All right, we got this. You ready to fucking lock in?
Center.
Lock in, Dr. Eric. Dr. Flip Cup.
I'm so centered. The centerist of all the flip cups.
Of all the flip cups. I'm so excited you're here.
Thank you.
All of my fans are so excited you're here. I've never gotten more questions for anyone ever.
I love that. That means the world to me.
Yeah. I want everyone to know about our backstory first. We've been friends for 15 years? Not longer than that.
Since college.
So
yeah, longer
2008. What's the math on that? I'm really bad at math. Are you good? You're a doctor. You should be good at math.
What is it, 26?
Yeah.
And
so
28.
It's 18 years.
So 18 years.
Fuck.
I mean,
that's
we're old.
Depressing.
That means we're old. We don't look old.
Right, because of you.
Which is why.
Yeah. And because of you, we don't look old.
Exactly.
I just got a DM today that my 20-year high school reunion is coming up.
Fuck.
And they're like, are you coming? And I'm like, you could not pay me enough money. I was like, you would have to pay me an appearance fee and still I would just keep the deposit and not show up. Mm-hmm. Like, you couldn't force me by law, by gunpoint to ever go back and hang out with those people.
I don't think anyone should go to a high school reunion.
I think it's for losers.
I think we should just let it die.
I think we should just let it die. And if you peaked in high school, just enjoy that time of high school. You know?
Because you're bald now.
Because you're bald.
Sorry.
Everyone actually needs to not buy a dress for their high school reunion and save their money and come see you.
Yes, that's what I've been saying. That's what I've been saying.
The high school reunion should be at a doctor's office.
Yes.
20-year high school reunion should be at clinics.
You get skincare eval, full facial, balancing eval. We'll do everything for you.
Do it all. Okay, so we were friends in college, and then I think we were close in college, but we became closer after college because you went to med school and I went to jail.
You know, opposite sides of the...
You know, we went different directions.
Yeah.
But you were my pen pal when I was in jail. Because you were like bored in med school. Well, not bored. You were busy.
I was
like
busy.
You were bored.
Busy, but
every once in a while you would carve out time to email me.
Yeah.
It's just fun.
I thought that was funny that we emailed. Like, no one really emailed at that point because we all had Blackberries. Does anyone remember Blackberries?
Oh my God, do I ever.
Blackberries? I loved my Blackberry.
I peaked during Blackberries.
I loved the little keyboard.
BBMs.
Yeah.
Oh, God.
Now I'm doing BBLs.
And from BBM to BBL, baby.
That should be my podcast.
Yeah.
From BBM to BBL.
Yes.
Wow.
Millennial Doctor Pod.
Here we are.
Too many people wouldn't get it.
No. It would just be for millennials.
It's a real niche.
Very small niche.
Yeah.
People were looking for fucking wagons.
Yeah, exactly.
Very small niche.
Yeah.
Millennial wagon.
Yeah, a millennial wagon. Are people still getting BBLs? I thought those were over.
So the BBL, as culture knows it, is dead.
Yeah.
The Kardashian BBL, the Miami BBL.
They got them all taken out.
Dead.
Yeah.
Absolutely dead. The skinny BBL is very well alive.
Okay, what's a skinny BBL?
Skinny BBL is something that I specialize in for sure.
Not when you say it like that. You said specialize in. Something that I specialize in.
I'm going to make it awkward. If it can be awkward, I'm going to make it awkward.
Unlike speaking, which you do not specialize in.
I don't specialize
in specialize in skinny BBLs.
Okay. You had your moment. Yes, okay, I do specialize in skinny BBLs. So what is that? It's really, really high definition liposuction, like body contouring to a stubborn area. So like love handles, flanks,
what's
some high definition abdominal area. The love handle. It's like
okay. Well, you said love handles flanks, and so I was like, what's a flank?
Love handle / flank.
Okay. Like I just know a flank steak. I don't know.
This ain't a steak.
Yeah.
So it's like that fat and hard to get areas of the body, like the genetically difficult fat to treat that diet and exercise doesn't necessarily take care of. That's what liposuction is for.
Okay.
Incredible contouring tool. Do high definition, very natural result for the abdomen. Like usually people want 360, so all around the torso. And then I use only the best fat and do really, really specialized, precise, custom fat grafting to the hips, hip dips, and just a little bit for projection.
Okay.
And honestly, most of the results from that are from really, really good lipo.
Okay.
It's not even the fat grafting. Everybody thinks it's the fat grafting. It's really good lipo. The fat grafting is just the chef's kiss on top.
So we need to put some pictures in. Can you share some pictures with people so they can see what that looks like?
Yes, for sure.
So
is this me putting pictures?
Pictures? No, they'll be. Okay. All right.
I'm stopping.
All right. So anyway, the pictures are going to be inserted there where Eric is having a meltdown.
Yes.
Where Eric is reenacting Star Wars. So what was I going to say? I completely forgot. Oh, the lipo. I want to talk about lipo because the downtime on lipo scares me and people. I've talked to you about arm lipo before. And then I went to Pilates and I got rid of a lot of my arm fat.
Good for you. Yeah.
But I was really thinking about it. But then my friend, her sister got liposuction and just told me like horror stories about how you like leak.
Depends on who your surgeon is. Depends on what their technique is. There's so many different techniques for liposuction. So many different techniques that are surgeon dependent and also device dependent, like based on what technologies they're using. So I use a combination of power assisted liposuction, ultrasound assisted liposuction, and then I also use Renuvion for skin tightening. So those are 3 technologies that I use almost for every liposuction case that I do.
Okay, and so how much are we leaking? Be honest.
Yeah. Depends on the area of the body too. The more tissue that I have to take off, the more fluid I have to put in to get that tissue off, and then you leak a little bit extra.
Okay.
So if we're just treating like a small area, so in order for me to do liposuction, I have to put fluid under your skin. It's called tumescent. That is a cocktail of sterile saline, numbing medicine like lidocaine, and epinephrine, which decreases bleeding.
Okay.
So I put that in under the skin. I let it sit. You're asleep in the operating room. All of that medicine works on the fat, and then I can safely and reliably take out that fat without too much bleeding.
Okay.
So if you use too much of that tumescent at the beginning, or you're taking a lot of tissue out and you're using more and more tumescent as it goes on, then there's a lot of that extra fluid left over that your body hasn't absorbed, and that will leak out.
Right. And that's when you get leaky and gross. Okay, so
the leaking isn't necessarily a bad thing.
It's just disgusting.
It's just absolutely disgusting.
Be honest.
Yeah.
Like if you're sitting on a couch leaking for a couple days, you're like, but in summer, I'm gonna look snatched.
Just give me 6 weeks.
Yeah, just give me 6 weeks.
Yeah.
One of the questions that I had, what were you gonna say?
I was gonna say, that being said, liposuction is a long game. It's not short term. Like it's not a quick fix.
Explain.
Liposuction is a long game, not a quick fix. So that means you get your liposuction done today, you need a good 4 to 6 weeks to recover from that. And full results from liposuction, which require the body's natural ability for that skin to snap back, takes 3 to 6 months. That being said, most of your result you're going to see in about 6 to 8 weeks after surgery.
Okay, so one of the questions that I had was, I didn't have this, one of the listeners had it. She did liposuction, and then when she gained a bit of weight back afterwards, it started going into the areas like it was only going into the areas that she didn't have liposuction.
Yes.
Let's talk about that because
this is not
haunted.
a myth. This is not a myth.
Okay.
So when we're born, we have a set number of cells, of fat cells. Say that's 1,000 fat cells, just to put a round number on it.
Mm-hmm.
So when we do liposuction, which is one of the only mechanical ways to permanently remove those fat cells from our body, then they're gone forever.
Mm-hmm.
So we have 1,000 fat cells when we're born. Whether we gain 300 pounds or lose 300 pounds, we have the same amount of fat cells. They just get bigger or smaller based on the calories that we're eating.
Right.
So if you have 1,000 fat cells, I do liposuction. Say I take out 200 fat cells. So you have 800 left. Whatever calories you're eating get evenly distributed between 800 fat cells instead of 1,000 fat cells because I took out those 200.
Okay. And so, but fat cells, as I'm understanding it, they stay where they started.
They stay where they are.
Okay.
Yeah.
So they don't move.
Mm-hmm.
So then that's kind of haunted.
If
you get like liposuction on your stomach and then you gain weight and then everything's big except for that. Is it like a divot? Like can you skateboard off of it? Do some sweet tricks.
Kind of, yeah.
A little finger skateboard.
Yeah, you could.
Yeah, drop it in.
Yes.
Okay, so then could you just not get, are you seeing, I was going to say something stupid. I was going to say, can you just get all your fat cells removed? But you need some to live,
that would not be advised. You do need fat cells. Fat cells are great. I feel like, things are cyclical in the aesthetic world. Like fat is good and then fat is bad and then fat is good again. So like fat transfer is an incredible tool. It's great to restore facial volume. Mm-hmm. It's great for hip and buttock projection. Mm-hmm. It's great for breast dogs. I can do a small breast dog with fat transfer.
Could you do one on me with my fat?
You don't even have any fat.
Well, I do. Could you get it and put it in my tits?
I mean, I could.
Are you seeing a lot more people just doing fat transfers?
There are a lot of people that are way more interested in fat transfer because it is more natural. That word is a big buzzword in plastic surgery right now. And because it's not a foreign object. It's not an implant. It's not like a device you have to put inside your body. Right.
So let's talk about implant sickness because this is something. So basically, I posted that unhinged text the other day on my Instagram, being like when I was texting my friend on Passover that I wanted to get fake tits and also that I made a sex tape. But
did you make a sex tape?
I did. I did.
Okay, so
it's not for public consumption.
It's not for this podcast.
No, I insert the clip here. I'm like, Eric's doing like. And the sex tape is here. So I posted this thing about how I want to get fake tits, and it's funny because it's almost like right down the middle, like 50-50. People are like, yes, girl, it's the best thing I've ever done. Do it, do it, do it. And then the other 50% are like, no, don't touch your body. People are talking about how they got it and they got sick from it. And, certain bodies just reject it. Like, what is your experience with bodies rejecting implants? How often is that happening?
So this is a hot topic in plastic surgery. And I will start with, there's no one decision that's right for everyone. You have to decide on who you are as a person, what your aesthetic goals are, what your health goals are, kind of what you're interested in, and where you want to be. So one decision is not for all of my patients. So I have patients who love implants and will forever have implants and will stand implants till the end of time. And then I have patients too that are like, I don't feel comfortable with that. I don't want the maintenance that's involved with that at times. And
what maintenance is involved?
Any implant, whether it's a knee implant, a shoulder implant, a breast implant, is not a lifetime permanent device. Right. So you have to do something with that at some point in your life. So you never know when the end of your life is, though. So it might be your last implant. I don't know. Yeah. I don't know when you're going. Like,
I know when I'm going.
We know
and I only need one boob job. I'm one boob job away.
Quality, not quantity. Oh my God. So my discussion with breast implant illness. So this is a hotly debated topic online, within plastic surgery, within medicine in general. So the basic concept of breast implant illness is that patients are getting breast implants in their body and that they're having symptoms, and their thought is that the implants are causing their symptoms. There's been so many studies on this so far. There are studies currently going about this. We haven't been able to find any objective data like when someone has implants and they have symptoms A, B, C, then we see this blood test that's elevated. We haven't seen that yet. We're still looking, we're still searching. As a doctor, as a human, I can't tell my patient that they're not feeling what they're feeling.
Right, of course.
When they tell me my body's in pain, I have foggy memory issues, I can't focus, like all my joints hurt all over the place. I want to help that patient, like whatever that means. If they say, I think it's my implants, I say, I'm here to support you. I can help you on that journey. So I can take your implants out for you. I never promise anybody that taking out those implants is going to 100% fix their problems.
Right.
I've had patients where it doesn't help them at all.
Right. And I think it's a tough thing to gauge too, because it's like you would have to do some sort of like psychological and physical evaluation on a patient before and after.
Yeah.
Right. You would have to know like what they were struggling with before, and maybe it got amplified by the insertion of this,
For sure.
or maybe you know what I mean? Like there's just so many, I think, different variables in order to test that. But I also logically look at it like, okay, yeah, you're putting a foreign body inside of your body. Of course, that might have negative repercussions.
Right. Every single thing we do as a surgeon, as a plastic surgeon, has risks and benefits.
Right.
So every time I see a patient and they say, these are my aesthetic goals, I give them options of what I can do for them. And I say, every option has a risk and a benefit. And then we balance those out. And usually the patient and I come together and we pick an option that has the most risk. Sorry, the least risk.
And that's what we're doing here at Impressions.
The least risk with the most benefit.
Right.
So, yeah.
And what do you do with a patient who comes to you with like a laundry list of shit they want to do? And if they all want to do it all at once, like how do you handle that?
That's a really good question too. So that demographic of patient for me is usually my weight loss patients. So I love my weight loss patients. They are some of the hardest working, well-deserving patients in my entire practice. So whether they've had bariatric surgery, whether they've been on a GLP-1 medicine, they've lost 50, 100, 150 pounds, and they have extra skin on their arms, their breast, their belly, their thighs. They're like, they got it going on. I had a lady call herself a flying squirrel. I thought it was wild. It's like, I got a good cackle out of that.
No, that's funny. I mean, you have to have a
good
good
so
sense
much arm skin after
you,
losing over 100 pounds.
Yeah.
I mean, that's wild. So,
yeah.
I have so much grace and so much respect for these patients. They've worked so hard. So if someone wants...
Or the GLP-1s have worked so hard.
They worked such a heavy
I
lift.
love your reframe.
Such a heavy lift.
Like, they've worked so hard. Stabbing themselves in the stomach once a week.
They're causing pain.
That's true.
Pain is beauty.
Yeah.
So when someone comes to me like that, they've lost 150 pounds. They want their arms, breast, abdomen, back,
legs,
butt,
everything.
legs.
Yeah.
I can't do all that at once. If I did that all at once, that would be 12 hours of surgery and you'd be in a body cast. Like, that's just not safe to do.
Yeah, and you'd probably die. I mean, that's when you see like all these people going to get laundry list surgery in other countries that are unregulated.
Because they'll do it.
And then they die.
They'll do it. Yeah, they'll go to Colombia, Venezuela. I saw a patient today that had a bunch of shit done in it. Sorry, am I allowed to swear?
Yeah, of course.
Okay.
What? It's my podcast.
A bunch of shit done in Venezuela and she swapped.
Yeah.
So now she has to pay double here, like double the cost to get it redone.
Yeah. So
really
when people come to you with the whole list, do you just like stage it out by like, this is what we can do Q1, this is what we can do Q2,
So we make a priority list. That's like the first thing I do with my weight loss patients. I say, what are your priorities? Like, what are the areas of your body that bother you the most? What do you think about every day? You get up in the morning, you get dressed for work, you look in the mirror. What's the first thing? You're like, if I could only get rid of this, my clothes would fit better for work, or I'd feel more confident when we went to the pool or something like that. So we prioritize the whole list, top to bottom, 1 through 6, whatever it is. And then I break off, I can do your arms and your breast together. Those go really well. And so maybe we take a slow stage 1. We'll do arms and breast. You also want abdomen and thighs. Then I can do that at the next stage. So you bite it off kind of piece by piece, makes it really manageable for people. And then the recovery is manageable. You can actually like focus your energy and your body's energy to recover on one place at a time.
Right. Rather than everything all at once. Yeah. When I look in the mirror and I'm like, what? My ass fell down.
Recently,
my ass fell down. What do you know about asses falling down? What do you know about gravity and age, Dr. Eric? Because I look in the mirror and I'm like, bitch, you got it going on. And then I look to the side and I'm like, where did that down go? I used to have a fucking ass. You know what it was? Because I did Ozempic and I lost all my muscle.
Yeah. So some of it's muscle loss. Some of it is the change in fat composition as well. So there's some structure that's along with the muscle and how the muscle and fat are connected. And so when you lose volume and you lose structure, that's when and gravity takes over. I guess skin laxity is multifactorial.
Not a fan. So what can I do to get it? Do I just have to do squats? Bulgarian split squats?
Yeah, I mean the best treatment for that is multifactorial, which means, someone who goes to the gym at least every once in a while. You don't have to go to the gym every day, but resistance training helps to build up your glute muscles. Also, fat grafting is a great option to restore volume, not to make anything look unnatural or...
So when you're fat grafting, are you just injecting fat?
So I have to process the fat from liposuction down to only the healthiest amounts of that.
Okay.
Fat is composed of fibrous matrix with then the golden globules of fat that everybody thinks about when they think about fat. So I take out only the healthiest portions of that, throw away the fibrous tissue, and then prep it. I want to make sure it's the right size for the area of body that we're going. And then we re-inject it subcutaneously. So just under the skin into the tissue under the skin.
And before you put the fat in the body, do you say, are you ready to be a big, fat, juicy ass? Are you ready to go? Or do you pump the fat up?
Do I motivate the fat?
Yeah.
Fat motivator?
Yeah. You have to speak some life.
I probably should be.
Yeah, you should speak some life into that fat.
I don't do enough fat motivation.
Are you ready to be not hated anymore? You're not the hated abdomen fat.
Right,
you are the loved titty fat.
It goes from the love handles.
Yeah.
To like
the titties
getting
and the ass.
handled.
Yes, exactly.
It gets handled once it's
from the love
back
handles
there,
to handled.
To getting handled.
Getting handled. And honestly, I think you should start pumping that fat up.
I think we
Little
should.
mantras, fat mantras.
We should do something about that.
Yeah.
Yeah.
I think, everything's life. Life is, it's all listening. So you may as well just talk to it.
It's a cycle.
Just talk to it. See if you get a juicier ass. It might be more excited to be. Let me know the results.
How do we prove that by evidence?
Let me know the results if the asses are fucking juicier.
I like that. I do like that concept though about taking bad fat and making it into good fat.
Yeah.
I think I should make a video on that.
Yeah, it's fat that like you go from loathing to loving.
Yeah. Loathing to loving.
I'm just coming up with
your podcast names.
Yeah, I'm coming up with all your marketing.
Okay.
For the rest of the day, I have nothing else to do.
I always need that.
I got a fucking job.
I always need names for rear ends. Like I have a lot of patients recently call them wagons. Like they're looking for a wagon. Like how big do you want the wagon? Things like that. Monster truck. I had those monster tires.
Dumps like a truck.
So that
guys
more
like
millennial oriented, for sure. Dump truck. But so one of my patients said monster truck tires. I thought that was a good one.
Okay. Yeah. If my ass looked like a monster truck tire, I would
tread on it.
I would yeet.
Is that a good yeet or
no? That was a bad yeet. Okay. I don't want anything looking like a monster truck tire.
Tread on it?
No.
Okay. Gravedigger. That could be the name of your monster truck ass.
Gravedigger?
That's a monster truck name.
Is it?
Yeah. It's a really famous monster truck. I know this.
I didn't know that there was famous monster trucks.
Yeah.
Did you ever go to those? Well, I guess you're from Kentucky, so you probably did that for fun.
Absolutely, go to Monster Jam. I take my son to Monster Jam. Did
you take dates when you were in like middle school to Monster Jam?
No. It's a purely experience.
You went by yourself.
No, with my family.
You wandered into it by yourself. No. What are the other ones? Gravedigger.
There's
Gold digger.
I don't know. I can't even remember right now. There's a lot. There's like Toro Loco. It's like Crazy Bowl. That's a good one. There's a shark one. I forget what it's called.
Okay, well next time you go, you can text me.
Next time I go, I'll text you.
Yeah, next time you take your kids. Okay, I'm gonna get into some of the listener questions. Okay, what are your thoughts on Easy Gel under eye filler? Is it better than standard filler? I don't even know what that is.
So Easy Gel is a product that is made using your own serum, like from your blood, and it kind of reconstitutes it into a more like an autologous product, which is a product from your body.
What the fuck did you just say to me?
Autologous is a product that's from your own body.
Is it PRFM?
Yes, it's very similar to that.
Okay.
Yeah.
So that's where they take your blood and they put it in a centrifuge, and then they get the platelet-rich plasma, and then they inject it, and that makes it. But what I've noticed about
Easy Gel is like a proprietary company that like you use the patient product with their product, you combine them together, and then that's what you use to inject.
Okay.
Yeah.
So my experience with PRFM is that it looks amazing for like 2 weeks.
Yeah.
And then it vanishes.
Goes away.
Yeah, because I think your body just reabsorbs it, right?
So the goal of that is the results are supposed to be bimodal, which means you get a result right away, and then you also get a result later on. And it's supposed to be from the initial volume introduction, which you get like the day of the procedure. Right. And then slowly, like you said, that kind of gets reabsorbed. But it's supposed to stimulate growth factors, stimulate your cells to increase collagen, increase elastin, build a little bit of volume for you there. And oftentimes they don't really work as well as the companies say they do. Right.
Yeah, I think that's the thing. It's a bit of a snake oil, right? Because I was working with my injector in LA. Don't get mad at me.
I know. I'm jealous.
Don't get mad at me.
I'm jealous.
But I was working with her, and she was talking to me because I do have hollow under eyes, and she was talking to me about under eye filler. But I have this fear now because I've seen so many things on Instagram about how filler doesn't fully ever dissolve. Is that true?
Depends on your metabolism and but yeah, I've seen patients who've gotten under eye filler years and years ago, and I'm dissolving it over here, 5, 6, 7 years later. Right. So it's very patient to patient dependent. Sometimes people's body, it depends on what type of filler as well. There's some fillers that are pretty gentle and clean, and there are some fillers that are not as clean and that I wouldn't recommend to people.
Right. Which ones are those so that people know?
I am not a big fan of Juvederm.
That's what I used to get in my lips all the time.
I know.
What are you going to put in my lips today?
I love RHA. RHA is one of the newer fillers. Okay. The technology is new. The process is new. The way they handle their hyaluronic acid, it's new. It's improved. The way I explain it to patients is, so Juvederm's patent is probably 30 years old. So because of their FDA patent, they have to produce that product the same way, per the patent. So for 30 years, they've been making the same filler. Would you drive a car that's 30 years old?
Well, it's vintage, and that's kind of stylish.
Well,
my vintage lips, my vintage dick sucking lips. All right. No, I did Juvederm for a while, and then I got a little filler blindness, and I went into this girl. I was literally just going to laser away.
Oh God.
And I was going to this girl.
My heart. My heart.
Be still, my heart. And my lips were fucking stupid, and I was like, but I loved them. And I remember my lesbian best friend Allie, and then one of my really good friends from high school, Trevor. Both of them were the only two that were like, you look fucking crazy.
Thank you, Allie and Trevor.
Yeah.
Thank you.
Yeah. I will put a picture in of that because I really thought I was doing something. And Allie's like, you look like you've been sucking on the inside of a bottle. She's like,
it wasn't a bottle.
It wasn't a bottle. It was something else. We know.
Not a bottle. We know.
We know. No, you know when you're a kid and you put your lips in the bottle like a fish?
Did I do that?
Suck in?
I don't think I did that.
Really?
I don't think I did that.
Oh, okay, well.
Sorry.
Baby Hose did that. Baby Hose.
Hose in training.
Hose in training did that.
HITs.
Yeah, HITs. No, but I got filler blindness, and I finally went to, so Amy is the injector that I work with in LA, and she's brilliant. And I went into her, and she's like, "We're dissolving your whole lips."
Yeah.
She's like, "I can't even."
Sometimes you have to do that, and
because,
then give a reset.
Yeah.
Let everything heal, and then you can expertly, precisely,
But she, great. Thank you. We're making them a little bigger today, I think.
Okay.
A little?
I wouldn't say a little. They look great right where they are. So just a little kiss of
when I go like this, they're wrinkled. Do you see that?
That's supposed to happen. That's called normal anatomy. Natural anatomy.
Just a little.
Okay. We can do a little pop.
Little pop. But Amy, when I went into her, she made me dissolve it all because she has a rule where she will not work on someone else's work. Do you have that rule?
I like that. So Surgically or non-surgically?
No, I mean,
I don't have
I
that
guess
rule.
no, you can't have that rule because if someone comes to you with like something a different surgeon
Yeah.
fucked up, you have to be able to do
Yeah.
it. But like, I guess for like lips and that kind of like more minimally invasive stuff, if someone came and has like, you know, crazy lips, let's just use my example, and they come and tell you to do more, will you be like,
oh, absolutely. I say we got to dissolve this.
Yeah.
We got to start all over. We need like a hot reset.
yeah,
And most people are pretty receptive to that.
yeah,
There are a couple people who've been like, oh, okay, you know, not for me. And I'll go, okay, well, I'm not for you.
yeah.
So
How painful is dissolving lip filler? Have you ever done it? Because
like
I've
on
done
myself, I don't think it's too painful.
No, it's so painful.
Is it
Fuck
really?
you. You have to know this. It is the most. It should be used as a torture tactic for the
What?
military.
You
It
must
is-
have had some nasty filler in there or something.
Well, it was Jupiter. It was Jupiter. I was dissolving
There you
my
go.
vintage
We're
Cadillac.
Yeah.
Okay.
You're probably paid for it.
Yeah.
too.
It hurt so bad. Like my eyes were involuntarily just like
wow.
crying.
The lips are sensitive too. So whether you're doing filler in the lips or dissolving the filler, they're still pretty sensitive.
Yeah. Okay, so your thoughts on Easy Gel are yes or no?
Depends on the patient.
Okay, but what would a better alternative be for under eye? Because what are you using for your under eyes? Because they look great, and I know you're stressed out and you work late. And
Thank you.
You have a lot going on.
A lot of skincare. I do a lot of skincare.
What skincare? Tell us. The girls want to
The
know.
girls would know. So I am an elastin girly myself.
Mhm.
So I love elastin products. My basic skincare routine is gentle cleanser. Then I start with my serums, which are HA
Mm-hmm.
and elastin restorative skin complex. Then I go vitamin C for the day.
Okay.
Then moisturizer.
Why is
That's
it that you can't use vitamin C at night?
You can. It's just like more productive during the day when the sun's out
Okay.
and you're like making free radicals during the day because there's sunlight. You can use it at night
Free
too.
radicals. What's a free radical?
Free radicals like when the sun hits your skin, it causes some skin damage and there's DNA that keeps fragmenting and is going all over the place. And so we have natural pathways in our body that scavenge all those free radical DNA pieces that keep those from harming you.
Okay.
So vitamin C supports your body in that process.
Okay, great.
So vitamin C during the day and then retin-A or tretinoin, some retinol product at night.
Okay. Then that's it. You're not doing anything else at night?
That's
What are you
it.
doing for the under eyes specifically, though? Because they look great.
Yeah. I don't have any targeted treatment for my under eyes. I mean, I have like good fat pads.
Yeah.
That's kind of the most important thing as you're aging to support that, which Sculptra is something that can do that.
Oh, yeah.
Occasionally your ADS.
We're going to do that today, too.
Mhm.
Let's talk about Sculptra. I had a few girlies that were interested in understanding it.
Yeah. Sculptra and Radius are the only two biostimulator products that we have. What that means is they are not filler and they are not Botox. It's a category all to itself. So these two products stimulate the body to regenerate itself. These are like regenerative medicine products. So that's why it's a whole new category of medicine. Like stem cells and regenerative medicine is like the frontier of not only aesthetics, but all of medicine. You know, we're trying to figure out how to grow kidneys for people that need organ transplants and livers and all these other things. So it really is the frontier of aesthetic medicine and all of medicine.
Right. And then what do you think we're going to be seeing in the next couple of years in terms of stem cells and like exosomes and all that stuff sort of coming front and center?
We already offer a product by the company called Acorn. They're based out of California, I believe. That's where they have most of their labs. But they actually take hair follicles. They take about 50 hair follicles. They take the stem cells from your hair follicles and make a product they call Secretome. It is like a super active PRP, a super active PDRN. It's your own stem cells. It's your own DNA. It's really, really potent, really, really powerful. And that's available right now.
But what are you using that on?
So per the FDA, it's only supposed to be applied topically.
Okay.
So what we would do is a treatment like microneedling or a CO2 laser that creates microneedles, micro channels in the skin.
So you would use that. So when I did my CO2 laser with you, you did the PRP. But you would do that instead.
Correct.
And then what are you seeing, like substantial difference in patients?
We're seeing a really big improvement in not only recovery from that procedure, so whether it's the microneedling or the laser, like speed to recovery is super fast. But we're also seeing like a crazy skin glow, like an enhancement in that patient's their overall aesthetics. It looks great.
That's so exciting. I've seen like the Kardashians go down to Mexico to do sort of, I don't even know what they're doing down there. It's some sort of, have you seen this?
I haven't.
Okay, so I'm going to have to articulate what it is. I think they're doing like...
kept up with the Kardashians.
You haven't kept up with the Kardashians, and how dare you? It's, let me just Google it because I want to see what it is exactly so I don't...
I'm sure it's some sort of like gene therapy or stem cell treatment or...
You guys, this episode is brought to you by Berber Hair Oil. Please take a look at my hair. Okay, fine. It's still not where it used to be, but honestly, we're trying. We're doing it. Burdock Hair Oil has changed my life. It has changed my relationship with my hair. I was one of those girlies that was like, my hair's not long enough. I need my hair to be longer. Rah, 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 rah. And then I put extensions in, and then the extensions tore all my fucking hair out. And I was like, maybe my hair was long enough. And it takes it's just hair and it regrows, but it takes a long time to regrow hair. But the burdock oil, I've been doing hair oil treatments twice a week. You do the dermaplaner on your scalp, you rub the oil in, give yourself like a nice little hair treatment. Listen, if nothing else, it is a really nice way to take a purposeful 30 to 45 minute break each week to take care of your hair, your head, your health. You know, just sit down and enjoy your life for a few minutes while your hair oil does all the magic and helps regrow your hair longer, stronger, better, brighter. I am on a hair regrowth journey and I am obsessed with it. And I want you guys to come with me. So use my code BRITT, BRITT at Berber.com, BURBUR.com. Use the code BRITT, BRITT for 15% off your first order and thank me later. Stem cell journey. Kim Kardashian traveled to receive Dezawa Muse stem cell therapy to treat a shoulder injury and chronic back pain.
I'm not familiar with that, but I know a lot of orthopedic doctors use PRP treatment in joints and things like that.
Yeah.
For like right now in the U.S.
Yeah, no.
That's probably very similar to that.
I did that. I have hip dysplasia, and right before the pandemic, I was getting really bad hip pain. I was doing hot yoga, and I went into an orthopedic doctor, and he told me I have hip dysplasia, which I never knew before, and he said that like my labrum was completely gone. Like I had completely worn it off, and he was like, you're going to need hip surgery probably before you're 40. And
was that just his hip dysplasia? Is that his way of telling you got a fat ass or something?
A fat ass. No, you know what hip dysplasia is. It's like German shepherds get it and they drag their hind legs around the yard. That's your girl. That's your girl.
You're going to peg leg it?
Yeah, literally. No, but he was telling me, he was kind of freaking me out saying you might need like a full hip replacement soon. And he's like, well, what I can do is this PRP treatment to see if it works. And I had to get an MRI first, which, by the way, the MRI needle and that whole experience was like one of the worst experiences of my life.
Terrible.
Like, how have they not figured out how to make the MRI needle?
I don't know.
Less like a flagpole.
Yeah,
like,
I don't know.
When they put it into my, I was just like, I'll die. I was like, I'd rather die. Like, just shoot me in the fucking mouth.
People
like,
hate surgeons. You should hate MRI people. I don't know.
Don't
hate
me. It was so painful. But then when I did the actual injections, it was 3 injections. It's not covered by insurance because, of course not. And it was $1,200 per injection.
Ooh.
Very pricey.
Man.
But I will say I got it in 2018 and I have had no pain in my hip and it's 2026.
That's awesome.
Yeah. So
see,
that
PRP works, people.
PRP works and I'll swear by it because it completely regenerated my labrum.
And you got it on your face.
I got PRP on my face. I got PRP. Where else did I get PRP? Oh yeah, I did vampire facials. And yeah,
same thing.
Yeah.
So this Acorn company, which they've branded it a secretome. It's like a super PRP, a super PDRN, like exosomes, all that stuff packed in one and very, very concentrated. And it's your own material, so there's no risk for rejection or anything like that.
Right.
And used very similar to the way the PRP is.
Yeah. Okay, great. So I was telling you last night at dinner that I had a surgeon in Turkey. So basically my boyfriend was going to get a hair transplant surgery.
Mm-hmm.
And I was like, well, you're in Turkey. I may as well just like go get some work done. And it's crazy, I know. What am I doing with my life? I was bored. But I sent this surgeon a picture of my face, and I said I wanted an upper bleph and maybe a lower bleph. And what he did was returned it with red arrows all over my entire face saying you need a facelift. And I am so open to getting a facelift. I don't think it's time for me to get a facelift yet. Maybe in like 10 or 15 years.
Yeah.
But what is it going to look like for me? Because I have had filler in my face. If it truly doesn't dissolve, what is that going to look like? Are you able to get a facelift once you?
Absolutely. You're absolutely able to get a facelift. So filler dissolves some of the way. A lot of times the patients that are left with a little bit of filler, it's like remnants of the molecules that are binding that filler together. That's something that happens through the production process. So that's why it matters which brand of filler you're using. So the dirtier the production process is, the dirtier that hyaluronic acid is. So the newer fillers have such a better production process. They're so much cleaner, and you're truly getting an HA molecule that's closer to your natural anatomic hyaluronic acid that already exists in your body.
Okay.
So using better products is always better for you.
Right.
But even though you've had some Juvederm or older products like that, it's still okay. You can
I got that all
absolutely
dissolved out. That's not in me anymore.
And that's always an option as well. If someone has a heavy burden in a certain location of their face, they can always get it dissolved.
Get it dissolved. But there are things going around on TikTok and Instagram saying that even if you try and dissolve it, it won't.
I think that's bogus. Any filler that is hyaluronic acid based can be dissolved. We use hyaluronidase, which literally means hyaluronic acid breaks down.
Yeah.
That's literally what it does.
Yeah.
Chemically.
So this is maybe just like another fear-mongering thing that's going around?
So there are things that you can inject that are not hyaluronic acid based. There are like fillers that are permanent fillers that you cannot dissolve. So those you have to be careful for. So be careful, know what's being injected in your face.
Which ones can't be dissolved?
Which ones can't be dissolved? I'm blanking on one of the names.
Okay. That's okay. We'll put
I'm blanking on the names. I'll put it on the...
Yeah.
We'll put
it in there and he'll...
Yeah. But one of them... so biostimulators, that's kind of another one. People talk about that. Biostimulators are not filler. So Sculptra and Radiesse are not fillers. Those are biostimulators. So there's something different.
Yeah. And do you think... How long are the biostimulators lasting?
Biostimulator depends on your treatment, like how many sessions of treatment that you get. But I've had patients where results will last 2 years, maybe even more. Then once I get someone to a happy place with a biostimulator, I say come back annually and get like a touch up to that.
Right.
And that just kind of keeps the top spinning.
Right. Okay.
So maintenance phase.
Gotcha. Okay. Not one more question. We have so many more questions. Okay. I have 2 kids, 4 and 3 years old, would maybe like to have one more in the future. I'm 28. Should I get a boob job now or wait until after the 3rd? I've also breastfed both of my kids and would plan to do the same with the 3rd. My boobs are not as perky as they were before the kids, and after breastfeeding look like deflated water balloons.
Oof. Unfortunately, I see this probably every day.
Yeah.
So wait till you're done having kids.
Yeah.
Because once we do surgery, when I do surgery, I make it right and tight on the day of surgery.
Right.
You go and get pregnant the next day, there's no guarantees.
Yeah.
So, your breasts are going to grow, the skin's going to stretch again,
right.
Everything's going to it's going to be a whole thing again, all over again. So wait till you're done having kids to have your breasts done or your abdomen.
Mm-hmm.
Wait.
Okay.
Wait.
And then this one was from a gentleman. He said, how can husbands best be supportive of wives who want post-pregnancy work done? Pay the bill.
That is the best question I've ever heard. Thank you, whoever asked that.
Yeah.
Who asked that? Phil from Omaha.
Yeah.
Thank you, Phil from Omaha.
Yeah.
That is the best question because I do see supportive husbands. I see terrible husbands. Mm-hmm. I see the whole spectrum. Let your wife run the discussion. Mm-hmm. It's her body. Mm-hmm. The surgery, Phil from Omaha, whoever this guy is, the surgery is not for you. Let me tell you, it's not for you. It's for her. Mm-hmm. It's always for mom. Mm-hmm. It's not for the dad. There's so much that goes in with pregnancy and having children and your own personal journey with your body and changes and then recovery from that, it's a wild ride.
Yeah.
So,
yeah, it's not only just a massive physical change, but it's also such a dramatic hormonal change. Like women just go through so much with pregnancy, and I don't think we really talk about it too much as a society for whatever reason. But you know, the friends that I've had who have had kids, afterwards, like the number one thing that I hear them say is like they're so happy, they love their kids, but also they miss their body.
I hear that every day.
Literally every day. Just
day.
like it's like even if they bounce back phenomenally and I'm like, you look great, they're like, but it's different. You know, different. My stomach is sagging, my tits are sagged, like everything's like a little different. It's
always a little different. Like you said, even if they had a great recovery and even if they're feeling good, it's always different. You know, different isn't always bad. But when things are stretched out and things are lower, and that's bad. That's categorically
bad. It's not great.
So that's one of the reasons why I do what I do, so I can give confidence back and stuff. That's the best part of my job, actually. So how to best support your wife? Let her run the show. Let her research surgeons, help her, but don't drive the boat on that. And
just
obviously
pay the fucking bill.
Yeah, pay.
Obviously pay.
She needs to find a surgeon that she's comfortable with. Like it really is a personal journey, and you got to find a surgeon that you're comfortable with, a surgeon where you like their aesthetic goal, you feel comfortable like working with them, talking with them, you feel like you can ask them any question, because you know it's a whole thing having surgery on your body. These are crazy. Like areas that, you know, you've breastfed from your breast before. Sometimes they're sensitive. It's a sensitive topic.
Even if you haven't breastfed, they're sensitive. And men, you should know that. Dr. Eric, you should know that.
I do know that.
I do know that.
That's what I'm trying to say. It's a very sensitive area, you know. So a lot of times on the abdomen, I'm removing C-section scars. There's a lot of emotion around that. Good emotions, bad emotions sometimes. You know, if women have had a difficult delivery, or maybe they had an emergency C-section or something, there's some trauma, you know, associated with that. So for me to be able to take that out and give them a really fucking good looking scar and boost their confidence through the roof, like that makes my day.
Yeah.
I feel honored to do what I do.
Oh, I love that.
I love it.
Surgically, what is the best way to get rid of stretch marks and excess skin on the stomach after having babies? Tummy tuck, or are there any effective non-surgical routes?
This is a rough question because the answer is not what I want it to be. The answer is, if you have a stretch mark, truly the only way to treat it is to remove it. Like you have to cut that skin out.
Okay. So how do you prevent, I guess maybe the better question is it's not going to help this person who asked, but how do you prevent, how do you prevent stretch marks when you're getting pregnant? Is there a way to do it?
There's a combination of reasons why stretch marks happen. So some of that is genetics. Can't help you there, sorry.
Right.
Some of that is the speed at which the skin is stretching. So like through the trimesters where you're growing a little faster, you're at a little higher risk. Also the amount of skin stretch. So if you have a massive fucking baby, you're going to stretch a lot more than maybe someone that has a little tiny baby. But that's also something that's hard to control. But something that is in your control is to treat your skin really well, nourish your skin, hydrate your skin, and use some really good products. Like I encourage my patients to use elastin reform and repair. That's like, I use that for my patients like before lipo, after lipo, before body lift contouring procedures. It's like fertilizer for the skin, increases collagen, increases elastin, really like gets the skin ready to be torqued and pulled and like totally manipulated.
That's what you gave me after my CO2 laser, right?
I think so.
Oh, it was dreamy. Very expensive, but dreamy. Very expensive.
Expensive but dreamy, just like me.
Yeah, exactly. Okay, so, and then they said for the lower abdomen excess skin, the only way
it's got to be surgically removed. There's like, unfortunately.
Yeah, there's not much you can do about it yet.
There are some non-surgical devices that can tighten a little bit, like a couple percent. Like if you're going to sink 10K, 15K, 20K into 10 treatments of some device and to shrink your skin 5%.
Just get a tummy tuck.
You could have just got a tummy tuck and look banging.
Yeah.
So.
Okay, so what treatments are available for tightening the skin under the chin and jaw area? I had a couple sessions of lipolysis, Lipolysis. Do you know what that is?
Lipolysis.
Lipolysis.
They probably mean Kybella, maybe.
Okay.
I think they were talking about Kybella.
On my chin, and it did work, but I have a little loose skin now, which is bothering me. I would love for it to be tighter without having surgery. I'm 34 years old.
There's a couple of options out there. The best and gold standard that I think applies, and I use it a lot for my body procedures as well, is Renuvion. It's the gold standard in surgical skin tightening. It uses radiofrequency energy and helium plasma to really evenly distribute heat and contract the collagen fibers that hold the skin like to the muscle.
Mm-hmm.
So you contract those fibers and it pulls the skin, like shrink wraps it back down to the muscle.
Okay.
I've seen it do some wonders. So if you have pretty good skin quality, it will work even better. If your skin's kind of stretched out and shoddy, it's not going to work very well. But like someone who's
what is
just
that
needs
run,
a little bit.
Do I need that?
No, you look beautiful.
Oh,
you look
I hate
fantastic.
when you say this. You know what I hate when you say the most? These lines that are coming in on my neck. These ones.
So horizontal lines are natural. There's not really.
I hate when you say this. I hate when you say this. You say horizontal lines are youthful. And I was like,
really
I don't
are.
remember being a child with lines on my neck.
So for the best treatment for those is skin health and quality. So like Sculptra would really help you there.
Okay.
Yeah, Sculptra or a little bit of dilute radius.
Okay, great.
We can do that.
Okay,
We'll
great.
do that in 20 minutes.
Perfect. Can't wait. I have a lot more questions, but I can't do all of them. I'm so sorry, you guys. I thank you all for submitting them. I thought I culled them down enough, but I obviously didn't.
We're too busy talking about dump trucks.
I know. We got really sidetracked. Okay. What is the most... I don't know if you can say this. You can't say this because of HIPAA. What's the most fucked up experience you've had with a client? I don't think you can.
Okay.
I don't think so, right? You're not like allowed to share that stuff. Well, I don't know. It's always so confusing to me because remember that woman that wrote that book, I Think You Should Talk to Someone? She was a therapist. And maybe you didn't read the book. It's an excellent book, but I
probably need to read the book.
It's a really great book about therapy. But she used like every single identifying detail about people, but she changed their names.
Oh.
So yeah. I'm like, are you allowed to? I don't really understand HIPAA, I guess.
I mean, I can tell stories, I just can't release
like who they are.
Information.
Okay, do you want to tell a story about something fucked up? Do you have one? What went the most horribly wrong for you?
I have a good story about a fucked up interaction.
Okay, great.
So there's a patient I saw, and she wanted breast surgery. So she came in, and she brought a guy with her, and they were flirty, friendly, and everything. And, so usually, mostly, I mind my own business. I don't ask a lot of questions, only like pertinent to, the medical case. I try to get to know people a little bit. And, she had this guy, we met, we did the breast consultation. She's like, yeah, let's go ahead and have surgery. I said, great, my coordinator will set it up. We'll see you for your pre-op, see you for surgery. Mm-hmm. Meet her in the office for surgery. We do surgery. I say, who did you bring with you? Right after surgery, I go talk to the family member. And I go out, she said, this is my husband. So I could do surgery. Surgery goes great. I go, great, I'm going to go talk to your husband. Go out. Not the same guy that I met during the consultation. I'm like, you're
like, good news, bad news. Good night.
Okay.
News. Good news, your wife got new tits. Bad news, she's not your wife anymore.
Well, I kept my mouth shut.
Yeah.
Totally shut.
Totally.
100%.
Yes.
Sir, everything went well. She's safe. She's doing well. She's good.
Great.
Good. Nice to meet you. Nice to see you.
Nice to see you. Oh.
Comes in for a post-op appointment. It was the first guy.
Oh,
again.
No.
I was like, what is happening?
Going on here?
Yeah, that was pretty wild.
Oh my God, fun.
I hope she's out there just vibing.
Yeah,
Absolutely
she is.
Vibing.
She is vibing with those new titties. Okay, I do word of the week on the podcast. You're going to know this word, I think. But I want to make everyone smarter. But you said a lot of words that I didn't know already, so I already feel stupid. The word of the week is edify.
Edify.
You know that word.
Yeah.
What does it mean?
Doesn't it mean, I don't know if I know for sure, but it's like, Isn't it to like encourage somebody or like
kind of
nourish them or something?
To teach someone in a way that improves their mind or character.
Yeah.
So like kind of what you just did on this podcast.
Oh, I love that.
You
Well, I hope I edified. Was able to
edified
edify
everyone's guess.
someone.
Pedify.
What? That is not the word of the week. That is not the word of the week here. No.
That is not
the word of the week. That is not the word of the week. I don't need that.
It's the complete
I don't need that on my SEO. Don't put that out.
Of your SEO.
Yeah.
What do you know about SEOs? Oh, if you're worried about your SEO, you shouldn't be on a podcast with me.
All right, fair.
Yeah, all right, well, get me out of here. I love you so much. I'm so proud of you and everything you've accomplished. I think you do great work. And if anyone's in the Chicago area or wants to travel for, tatas.
Travel for something. Yeah.
Something.
We have tons of patients come from out of town. We have a hotel partnership across the street.
Great. At the Days Inn.
No, it's a really nice place.
Joking.
It's a Motel 8.
Yeah, exactly. Motel 6.
What else was I gonna say? Yeah, I'm really proud of you. And I never, if 18 years ago you would have told me we'd be like doing a podcast about aesthetics and
one of us would be a surgeon and the other one would be a comedian, I think we would have been like, you've got the wrong two people.
I would have told you to shut the front door.
Yeah, shut up. Tell everyone where they can follow you on social media, please.
Yes. I'm most active on Instagram. I'm also on TikTok, but it's Dr. Eric W. Anderson.
Dr. Eric Anderson, we loved having you.
Thank you.
Thank you.